Allergies, itchy eyes or skin, cold or sore throat, tummy trouble, aches and pains? Think pharmacy first. Your local pharmacy is your expert NHS health team treating a wide range of common illnesses and health concerns with no need to visit your GP. Remember, always keep a well-stocked medicine cabinet and order repeat prescriptions in plenty of time. Find your local pharmacy at nhs.uk/findapharmacy. NHS, here to help.
This is the North East and North Cumbria Providers Podcast, highlighting the fantastic work taking place across the region to provide the highest quality of care.
Hi, and welcome to another episode of the Providers Podcast. I'm your host, Harry Newhouse, and on today's episode we'll be talking about the Diagnostic Imaging Network. The Diagnostic Imaging Network is a collaboration of all the 8 acute foundation trusts in the region working alongside partners such as Northern Cancer Alliance and Primary Care. To discuss this with me, I'm joined by the network's Programme Lead, Anne Anstee, and Programme Manager, Laura Berry. Welcome to the podcast, Anne and Laura.
Thanks.
Let's start off with quick introductions. Anne, please could you tell us a bit about your career in the NHS and what you currently do?
Sure, so I'm a consultant radiologist and I work at Newcastle Hospitals Foundation Trust. My background is that I qualified from medical school at University College London in 1997, and then I completed my radiology training in London and was then a consultant at Imperial College for 3 years before my family relocated to the North East. So my husband's Durham born and bred, so it's a great opportunity for us to move to the region and to be closer to family. I should also say I'm the head of school for the Northern School of Radiology across North East and North Cumbria, and I've been involved in the Imaging Network since 2018 when I was the workforce lead.
Brilliant. And same question for you, Laura.
Yes, hello, I'm Laura Berry, the Programme Manager working with the Imaging Network. I have worked for the NHS for nearly 24 years, starting off with admin roles, various different admin roles before moving into a directorate manager role, working within various services within the Trust over 7 years, and that's been primarily with South Tyneside and Sunderland NHS Trust. I then moved into this role, working with the acute foundation trusts over the last 3 years. I was born in Sunderland and always lived in Sunderland, so I'm very proud to be working with the local trusts to be improving healthcare services and health outcomes for the patients.
We're here today to talk about the Diagnostic Imaging Network. What is the network?
So the Imaging Networks are a programme that's run across NHS England. There are 22 imaging networks across England, and the North East North Cumbria Imaging Network is the largest imaging network in England in terms of its geography, extending from the east coast to the west coast and up to the Scottish borders, really down to the border of North Yorkshire. We're also one of the largest in terms of the number of acute trusts we incorporate, and so there are 8 acute trusts across the region. So geographically it's a challenging area, as we're all familiar with, and we've got great partners with our 8 acute trusts across the region as well.
Just to add into that, Harry, as well, as an imaging network we work, like we said, with all the acute trusts, but we've been working together to deliver some key asks by NHS England in areas such as workforce, digital, quality and procurement, but also working with the trusts on some key areas of work that they've identified with service improvements that could be made as well. And as part of the network, we don't have a headquarters, we don't have an office space, but what we do provide is the forum to bring the clinicians and the managers together to think about and discuss those key pieces of work and progress those.
And I think one of the really interesting things about our network, we just had a GIRFT visit, and one of the really interesting things about our network is the way that we are very patient focused, very integrated into those clinical discussions. We work very closely with partners in the Northern Cancer Alliance and Primary Care. We very much want the region to have imaging services that work for patients, that work for clinicians. And for us, it's all about improving equity of access to imaging in the North East North Cumbria, and those key deliverables that Laura mentioned of the importance of workforce for our region and that digital connectivity as well.
Just to clarify, GIRFT is getting it right first time.
Yeah, that's right.
It's a national...
Yeah, so it's a national programme, and they've just completed their visits to imaging networks, which was led by Giles Maskell, who's one of the former presidents of the Royal College of Radiologists, and really visiting all the imaging networks to understand what's happening, what they're achieving. And one of the things that was fed back from that was that actually what we're achieving from a very small team. So we're a small team, we're a nimble team, and so we're really working very closely with the trusts to improve imaging services.
The network has been created for now over a year. What has been the main focus and ambitions since the network started?
So I think some of our main focuses today has been around, as Anne's just touched upon, that workforce and digital aspect. So from a workforce perspective, we've created a network workforce strategy, which includes, among many other things, growing the workforce to meet the needs of the growing demand for imaging. As part of that, we've also produced a CPD and training plan. So this is about asking our staff what they want and what they need to build on their skills and improve their training, access to training. Using our resources effectively across the network to provide greater and equal access to training and personal development. So we really are providing the best for our staff to make sure they provide the best for the patients. And working alongside the Imaging Academy within the North East and North Cumbria to provide multi-professional workforce education and training. And then also within the workforce, we've set up some specialist interest groups within the network, which have been very much clinician-led, and that was really important to us, that we have the clinicians at the heart of those discussions around those service improvements, and really identifying what we need to improve for the patients and be able to clinically lead on those discussions. The other part is digital, and digital is kind of massive everywhere at the minute, isn't it? And especially in the NHS, and trying to really harness on those digital developments that are out there so that we can work differently and free the resources up that we have to be able to provide the best care to patients possible, but in different ways. So some examples of that, just to touch upon, is the chest x-ray AI tool, which has recently been rolled out across the network. We're doing another project on global work, called Global Work List, which is essentially allowing or enabling the trusts to view images across all of the different hospitals within the network. We've got another project coming up that's going to allow the hospitals to report across the network. So once a patient's been in and had a scan taken, then a consultant from another hospital can pick that up and report that. So that's in the pipeline. And we're also rolling out a digital project which is called I Refer CDS, which will provide education and training to referrers at the point of referral. So it's just a kind of a snapshot into all of the digital projects that are ongoing or in the pipeline at the minute to really change the way we deliver our services. And I think that the last part on that is really around communication. So we've really tried to pick up on communication within the network. We don't know what we don't know, that well famous phrase, and trying to get the trust to talk a lot more across the network, share successes and challenges, and be able to share lessons learned and look upon them across the trust and see what we can learn from each other, as well as sharing everything that's currently happening across the network and really getting that down to all the different staff groups so they're aware of the good work that's going on.
And that's something that we sort of build into all meetings, isn't it? Ask contributors to say what's happening in your organisation at the moment, what's the progress you're making, are there any areas that you think we could help each other with? And that's been a very productive way of really encouraging those conversations to promote mutual aid and working across institutional boundaries for the benefits of patients.
What are some of the key successes you've had since starting the network?
Well, Laura mentioned there the AI Diagnostic Fund, and this was an NHS England fund that was set up in 2023 to really explore and promote the benefits of AI in the NHS. And our imaging network was one of 11 successful bids for funding, a combination of capital and revenue of £2 million to roll out AI into our region. In imaging, the AI tools are there to support reporters, and the chest x-ray AI tool that we rolled out across the region works as a second look at x-rays after they've been reported by our highly skilled workforce of reporting radiographers and radiologists across the region. So there are 7 trusts currently involved, and that programme has been rolled out to all of those 7 trusts and is working well. It obviously very much fits in with the bigger picture of the Northern Cancer Alliance, looking at ways to improve diagnosis and outcome of lung cancer in our patients. As you'll be aware, lung cancer is one of the leading cause of cancer deaths in the UK currently, and its timely diagnosis is critical to good outcomes for patients. So a lot of thought has gone into this, working with our colleagues in the Northern Cancer Alliance about how this tool can be used to assist in getting faster diagnosis for patients at an early stage.
It's in the news a lot, AI. How much of an important factor is we are probably just at the beginning of AI, of what we can do. How important going forward in the NHS could AI be?
I think it's a tool that has great potential. What I think it's really important to do is to make sure that when you're working with these companies that and digital companies, that value for money is being delivered for patients. And I suppose one of the key areas of this is looking at those deliverables and seeing how this is improving patient care. So I think it's really important with all AI tools that we're all very much aware of what they have the potential to deliver, and whether that is being delivered for patients, those benefits are being delivered for patients. Do you agree with that, Laura?
Yes, and because it's such in the infancy of how we have, adopted AI so far within the network, we have got benefits realisation returns to send back to NHS England, and then we've took our kind of reassurance further than that. We are working with Health Innovation to conduct a service evaluation, as well as working with our digital lead within the network, who's looking at doing some audits within the network as well. So we've kind of got a number of different evaluation methods there built in to reassure us as well of the benefits that's coming out of using such tools.
So this chest X-ray AI tool, it's called Annalise AI, am I correct?
That's right, Gary, yeah.
The network has also helped with several successful bids for capital funding, such as the new CT facilities at South Tees and North Cumbria and a new MRI scanner at Gateshead. How did the network support such bids, and how will this benefit patients in the region?
So the network's really worked with the trusts and supported them through the bidding phase for the funding, and make sure that the documentation that was required for NHS England was presented the strongest possible case to have the best opportunity to be awarded that funding. Obviously, as you pointed out, we have had 3 successful funding cases lately. One of the bids was for replacement kit, which brought new technology to the area, but also increased capacity because the new machine was more efficient. The other 2 bids were for additional kit, which provided additional capacity and appointments for those areas. It provides greater choice as well for the patients, but also helps to reduce the waiting times. And those 2 bids were also for what we class as second scanners. So the site already had 1 scanner in situ, but actually bringing a second scanner on board builds their resilience and means that during periods of downtime, so if one machine goes down, the trust can still provide a service, so they can still provide a steam service without, and it reduces the need for patients to have to travel out of the area during such situations.
We've also recently seen the opening of the Metro Centre Community Diagnostic Centre, and over the next month or so we'll see the Stockton Community Diagnostic Centre opening. Does the Imaging Network have any involvement with the new regional community diagnostic centres, which you can hear more about in previous podcast episodes?
So the radiology department leads have led on the opening of the CDC, so through the network we've got natural oversight of what's happening. But they are really exciting developments, bringing scanning to the community, bringing scanning a lot closer to patients, increased job opportunities for the local areas as well, and feeds into that workforce planning, what we've talked about earlier on in the podcast in terms of the workforce strategy. So it is really exciting all around, and we're glad to be able to see them develop.
Finally, is the network supporting with anything else, and what does the future of the network look like?
Yeah, so we've got our focus is very much around delivering equitable access to imaging for patients, and we've got a number of projects that are ongoing with that. One of the areas where we've seen real success is in the interventional radiology services for the region, and working very collaboratively with all the trusts, but particularly the trusts that have interventional radiology centres within them. We've really been able to grow that multi-professional interventional radiology workforce to support patients. So I think that's looking at more projects like that, where we take a really holistic approach to delivering services for patients and are able to help support grow the workforce, support trusts as they grow those services is really where we want to expand and exciting prospects we hope in the future.
Brilliant, that brings us to the end of this episode. Thank you, Anne and Laura, for taking us through the Diagnostic Imaging Network.
Thank you.
Thank you.
Thanks for joining us for this episode of the Providers Podcast. Hit subscribe to keep up to date with the latest news and catch up with what we've been up to on our website and social media pages.